Another 40-year-old founder collapses in the gym. Another marathon runner has a heart attack. He is a Watermelon who spent 20 years in corporate trenches before realizing the hustle was basically a biological suicide mission.
Started actually with my son's illness. He had a medically incurable condition. Targeted changes in his diet and lifestyle. Within few months, we were able to cure something which was medically incurable or which was not getting result with any other modality.
Why are people with normal cholesterol level still dropping dead at the heart attack at the age of like 40?
20% of the cases which happens in the sudden cardiac arrest or sudden heart attack, they had certain heart defect in their organ by birth.
What is the basic difference between a heart attack and a cardiac arrest?
So you can say one is the plumbing issue, supply of blood gets stopped, and the other is electrical issue.
What are the basic things we need to cover as a regular test?
Tests like ECG, echo, 2D echo, TIMT. These are few of the tests you can get done. These tests gives understanding of heart from the functioning viewpoint. Biomarkers give the blood level work.
So, thank you so much for joining me on this podcast and letting us understand what are the causes or what are the things we need as a normal person we need to control so that we can have a. We have all seen the news. Another 40-year-old founder collapses in the gym. Another marathon runner has a heart attack. We usually say, but they look so fit. My guess today is that's exactly where the problem is. We are looking into wrong metrics. He is a watermelon who spent 20 years in corporate trenches before realizing the hustle was basically a biological suicide mission. He is now the founder of Pivot Health and the architect of her SPAN program. Welcome to the podcast, Ankur. Before we get into the depth of the podcast, could you please let us know about yourself? Who were you 10 years back when you were in corporate life and what started to feel off before you had the language for it?
I've been in corporate sector for now before I started in the health journey. I was in corporate sector for close to 20 years, and I had a personal incident. It started actually with my son's illness. He had a incurable or medically incurable condition, a skin condition, and we were not getting any solution. We have even approached different modalities like homeopathy and naturopathy and Ayurveda, but it was not getting solved. So that's the time when I started researching, and I was lucky enough to get guidance from a health and a lifestyle coach. And with targeted changes in his diet and lifestyle, within few months we were able to cure something which was medically incurable or which was not getting result with any other modality. So that was the pivotal point, and that led me one after another. I then went in deep to understand what is nutrition, what is lifestyle medicine, how exercise works, how can what is happen, what role they have when it comes to our health and also healing us. So that is where my journey started.
Okay, great. Okay, while doing the research, I came to know that you said that standard lipid profile is like looking at a car pain point to check if the engine is about to explode, right? Why are people with normal cholesterol level still dropping dead at the heart attack at the age of like 40? And that even happened in second. But you say that this is something that take years to build, maybe 10 years or more. So what are the silent signals our bodies are sending us as of right now, and we are just writing off it as in like we are too busy to even notice that.
Sure. So, Sapna, the thing is that one, heart disease is not a disease which happens just like that. It builds over a period of time. So it can be 10, 15, 20, 30 years. That is varies, but it's a progressive disease. That's first thing. And other thing which people don't understand or people have very less awareness, that there is no one metric. For example, when you say talk about your weight or is being overweight or obese, you have one number to say, okay, according to my height, this should be the weight, and if I am more than that, I am overweight, else I am obese. Similarly, for say blood sugar, you will say my HbA1c is more than X, then I have diabetes. But when it comes to heart health, that's not the case, because uh, it is a multifactorial disease. even your obesity, your blood sugar, your blood pressure. uh, it's a series of things which actually make it's a multifactorial disease. So this is why uh, one metric, you can't say कि मेरा cholesterol is high or normal, then I am okay. Maybe your blood pressure was a problem, maybe you had a high blood sugar. So that is one reason. Second, not all, but say around 20% of the cases which happens in the sudden cardiac arrest or sudden heart attack, they are 20% of the cases, they are what we call as congenial heart disease. Means they had certain heart defect in their organ by birth. So those events will not count as a technically something which was lifestyle driven or something which just happened. So this is why one cholesterol number can be one of the factors for sure, but not the entire health journey or entire heart health. So it has to be seen from all the perspective, and that's what we also try to do when we are trying and analyze a client's health. That we see all these factors, and also their genetic history, their age, all of them have a role to play when it comes to heart disease.
Okay. Okay, I want to ask very basic question. As of now, I think most of the people get confused with it. What is the basic difference between a heart attack and a cardiac arrest?
The thing is that heart is a muscle and it's an organ. It is a muscle end of the day, so it is continuously pumping even before when we are born, right? The third, the fourth month of conception, the heartbeat comes, and that's from that point. So even before brain or human body gets formed, heart is the first thing which gets formed in the major organs. Now, heart is a muscle. It is continuously pumping blood 24/7 till we die. So that's obviously working. Now that when heart is supplying blood, heart also supplies blood to itself. So because it also needs that continuous supply of energy. Now, in that supply, if there is blockage, which happens, in if in that supply, if the blockage happens, a clot forms or a plaque get formed, then the blood supply to heart is you know stalled, and that's when the heart starts to get affected, and that's what we call as a heart attack. In a cardiac arrest, something different happens. In cardiac arrest, you can say the heart stops beating properly. So the electrical functioning of the heart starts to stop suddenly, and that's what we call as a cardiac arrest. In case of a heart attack, as a progressive manner, a cardiac arrest may happen, but usually this is the difference. So you can say one is the plumbing issue, the supply of blood gets stopped, and the other is electrical issue. That means the heart stopped pumping. So this is the difference. Usually, most of the sudden deaths are due to cardiac arrest,
Okay.
because when a heart attack happens, you have more, what should I say, margin to survive or to till you reach in a hospital. In cardiac arrest, that margin is little less. So that's also very important to differentiate that these are two different events, but heart is the organ which gets affected.
For sure, because as of now, no, people around me or whatever news comes that is around the heart attack, that is around that that certain people died because of a heart attack. But when we even see we when we see in the news the cardiac arrest, we say okay, that is the heart issue or maybe something like that. That because of that, I wanted to understand the basic difference that you should be aware of these things. Okay,
Yes.
let's get to our next question. That is, there are a lot of viral news as of now, right? That particular person died in gym because of a heart attack, because of a cardiac arrest. And as a health coach, could you please tell us the truth, like when does that, is it because of a lot of exercise, or when does that exercise become a trigger for a cardiac event for us? And I just want to understand that what are the signs our body give to ourselves, that okay, you have to stop now, or this is something you need to get, you need to get a doctor.
Sure, sure. So Sapna, you consider a heart event, whether it's a cardiac arrest or a heart attack, like an accident on a road. Okay, so accident can happen with anyone and everyone, so that is there. So when an accident happen on a road, we don't blame the road, that, or the car, just that it is there. Same way, we can't say that because 75% in 75% cases, or maybe 80% cases, the heart attacks or heart events are happening not when they're not exercising. They're just sitting, lying on the bed, traveling, when those events happen. So it doesn't mean travel is bad or travel is the cause. It's just that where it happens, we tend to associate that event with that environment, which is an incorrect thing. We don't think still the majority of heart attacks are not happening in gyms. That is one thing we need to understand. Second is that any activity, even if when you're walking, maybe a mental stress or a sudden shock or sudden, any extreme event which happens, even when you're doing exercise, it is like you're giving some form of controlled stress to body. Okay, sometimes it may be an accident, or sometimes it is there. When you are exercising, you are doing some activity, you're pushing yourself, right? Pushing, I mean, in a good way, in a controlled way. So but when it comes to an event like heart attack, or a cardiac arrest, then the exercise could be a trigger for that, but not the cause. There is more risk of not doing activity, more risk of not exercising, that builds up your risk factors for heart disease, than exercise being a cause for it. So this is one very important distinction we need to remember, that exercise could be a trigger, or the event coincidentally happen in that environment. So that is one thing. But as I mentioned earlier, the heart disease is a progressive disease, which develops over a period of time. It those 10, 15, 20, 30 years when that condition existed. It's just that at that particular moment when you were exercising, that event happened, but that was not the cause of it. So how, then you ask that, how do we know? If you have not slept a day before, if you're not recovered, you're under high stress, your diet is not proper, you may be consuming alcohol, or you're a smoker, and then you're already put your body in a lot of stress, and then you are going and doing the exercise, then it may be adding that trigger for that particular moment, but you were already prepared your body for that event to happen. It just, as I earlier gave an example of driving a car. If you say, I'll not check my car properly, or my tires may not be inflated properly, I am not wearing a seat belt, so all these things you are already improved, or had a high risk probability for the event. So that is why I would say that exercise, a right amount of exercise, that is a different thing, should be there. But that definitely is not the cause. If exercise is done in a right manner, it is protective rather than a causative factor for a heart event.
Okay, okay. Then I have to have this, like, ask this question. We connect those events, like whenever someone dies in the gym, or maybe because of exercise or something. No, we connect it to the type of diet they are having. Mainly we connect that, okay, maybe he was having a lot of protein sources or some other things, and that's why that made pressure on his or her heart, and that's why he died. So is this a myth, or this is something to do with the our body as well?
See, as I mentioned earlier, it is a multifactorial disease. Okay, and if I have to say the main pathways which causes heart disease, when it comes to lifestyle driven, I'm not talking about genetics here, is your food, your sleep, activity, and stress. These are the four driving factors which results in development of heart disease. Okay, so food is definitely one of the factors. If you are and in food means the type of food you're having, whether your food has right nutrition, means right amount of food you're having, right macronutrients, carbohydrate, protein, fat balance is there or not, and then right micronutrients, your vitamins and minerals you are having or not. And then food timing, are you having meal at a regular schedule, too late, all those things are not there. So this is the first principles for the food. And obviously then there are other three factors which also may contribute, or amplify the impact of poor diet. So food is one of the driving factor, but definitely not, protein is not the driving factor. It's the right balance needs to be there.
Right. I think protein is the hype as of
plaque formation get more done, our blood pressure rises, heart over a period of time has to pump more and becomes weaker. So one off event, fine, at a certain frequency, body is able to manage this. But if it is happening very frequently, then over a period of time, you start to see some of these effects
Okay.
on our overall health and especially heart health.
Right. Okay. So we talk about stress management, right? And you talk about stress management versus stress resilience. Okay. And most people mix those up. Like we also mix those up. So how do you explain the difference in a way that actually changes behavior?
Yeah. So, one, as you rightly said, that we mix it up. Stress is a natural phenomena. There will never be a person who stress is interpretation of a situation. See, stress can be different forms. One is your mental stress, other is emotional stress, third is environmental stress, and then physical stress. So, so that is one clear definition needs to be there. We usually think of stress usually a mental stress, but we forget there are other three stresses also which operate in all our lives. So body, as I said, is designed to handle them, but when we push our body too much, whether it is physical, mental, emotional, or environmental stress, that's when body systems start to break down. Now, what I mean by resilience means that you build body's capacity to be able to take these stresses in much better manner. For example, let's take you exercise. Okay. Now, if you will say, okay, I'm on day one, I've never exercised, and today I want to do, a 5 kilometer run, you will not be able to do. Okay, then or if you try and do, you will collapse or something will happen. So that means you're putting excessive